Welcome to the Deep Dive, our health bulletin. And today we've got another really interesting topic. It's something that, well, it directly and indirectly affects you and me, which is exactly why we think it's so important to really unpack it together. Imagine for a second, diseases we maybe thought were under control, maybe even gone, suddenly popping up in new places, new towns, even new continents. Or maybe familiar threats, getting worse in ways we haven't seen before. Sounds a bit like a movie plot, right?
It does, but the science is really showing us well, it's fast becoming our reality.
Yeah.
And this deep dive today is all about that link, the connection between climate change and infectious diseases. It's becoming pretty undeniable. It might feel a bit abstract or maybe just overwhelming, but the effects, they're already being felt. Doesn't really matter where you live.
Right. And our mission today, really, is to try and cut through some of that complexity. We want to explore what the science is telling us now about this relationship. We'll look at how our planet changing is, creating these new weak spots in global public health. We want to pinpoint the mechanisms, the how, spotlight some diseases that are already on the move, and crucially, talk about what we can actually do about it.
Yeah.
What collective actions can we take?
Exactly. And to help us navigate this, we've drawn on some really solid sources. We're looking at comprehensive reports from the World Health Organization, the WHO, detailed analyses from global health groups focused on those often overlooked, neglected tropical diseases, and also some really cutting-edge new research that explores how these climate shifts create what scientists are calling new vulnerabilities for future pandemics. It's a lot to take in.
It is. So, okay, let's start big picture.
Yeah.
When we talk climate change, it's easy to think melting ice, extreme weather, that kind of thing. But what's often less visible, maybe more insidious, is how it's kind of quietly undermining the very basis of good health globally. We're talking the air we breathe, water we drink, the food we eat, even just the safety of our homes.
That's precisely it. The key insight here is that climate change isn't just some separate environmental issue. It fundamentally threatens those pillars we all rely on for health. Clean air, safe drinking water, enough nutritious food, secure shelter. These aren't, luxuries. They're the basic building blocks, and they are all under increasing threat.
And the projections, when you look ahead, the numbers are just sobering, aren't they? The scale of the health impact is huge.
Absolutely. The WHO estimates that between 2030 and 2050, climate change is expected to cause somewhere around 250,000 additional deaths each year. And that's just from four things: malnutrition, malaria, diarrhea, and heat stress. Just those four.
250,000 extra deaths a year.
Wow. And beyond that tragic human cost, the direct economic damage to health, that could reach something like US $2 to $4 billion a year by 2030. So it's a massive financial hit, too.
And I'm guessing this burden isn't shared equally. Who feels this the most?
You're absolutely right to ask that. It falls hardest on the world's most vulnerable, most disadvantaged populations, particularly in developing countries. Often these are places with weaker health infrastructures already, so they have less capacity to cope, to adapt without significant help. It just makes existing inequalities worse.
And it's not just physical illness either, is it? I keep hearing more about the mental health side of this too.
Precisely. The impacts definitely extend to mental health. Things like anxiety about the future, climate anxiety, or trauma from being displaced by floods or droughts. And like you said, it also undermines those broader things that support health, like having a stable job, access to education, reliable healthcare. It's like a ripple effect, weakening whole communities.
Okay, so that paints a pretty clear, if worrying, picture of the broad impact. But let's drill down a bit. How exactly does a changing climate drive the spread of disease? I remember seeing a statistic, an alarming one, but just how many diseases have already been affected?
Yes, that statistic really hits home, I think. The current science, summarized by the IPCC, that's the Intergovernmental Panel on Climate Change, it shows that a staggering 58%.
58%?
Yeah. 218 out of 375 known human infectious diseases have been aggravated, made worse by climatic hazards at some point.
Wow.
So it's not really an if anymore. It's more a when and how climate events will trigger or amplify outbreaks. More than half.
More than half of all known human infectious diseases. That's huge. Okay, so how? How does this actually happen? The research points to three main ways, right? Three mechanisms. First up, changes to where disease vectors live and their seasonality.
Oh.
So how does rising temperature mess with the biology, the ecology of things like mosquitoes or ticks?
Well, what's fascinating, biologically speaking, is how direct the link is. Temperature and rainfall are absolutely critical for these vectors. Mosquitoes, ticks for their survival, how fast they reproduce, and even their ability to transmit a disease. So as it gets warmer, mosquito larvae, for instance, they mature much faster, which means more generations in a shorter time. But, and this is key, the virus or parasite inside an infected mosquito also develops faster at higher temperatures. So mosquito becomes infectious sooner, and it can stay infectious for longer. It just ups the odds of transmission considerably.
Ah, right. So it's kind of like, how a plant might get a longer growing season with warmer weather, but
Yeah.
here it's disease-carrying insects and they're breeding faster and becoming infectious quicker.
Mhm.
That's quite an unsettling image.
It is, and the result is this noticeable shift. Pests and pathogens moving away from the equator towards the poles. We're already seeing mosquitoes, for example, surviving at higher elevations where it used to be too cold for them.
Mm.
Think parts of the African highlands.
Right.
Which means diseases like malaria could potentially reemerge where they were once wiped out, or even appear in totally new places.
Okay, that makes sense. Now, the second mechanism you mentioned involves water, increased water temperature, and changes in precipitation water cycle.
Mm.
How does water play into this beyond just being a place for mosquitoes to breed?
Well, water is a huge factor in so many ways. Rising water temperatures, for one, create a warmer, sort of cozier environment for many disease-causing microbes, pathogens. They survive longer, they multiply faster, and sometimes they even become more virulent, more potent.
Mm.
Warmer water also means that animals carrying these diseases might harbor higher concentrations of the pathogens. And then think about human behavior. When it's hotter, people tend to drink more water.
Sure.
If that water source has more pathogens in it because it's warmer, the chance of ingesting them and getting sick goes up.
Can you give us a specific example, something maybe people have heard of?
Yeah, sure. Harmful algal blooms, specifically cyanobacteria, they love warmer water. They really thrive above about 25 degrees Celsius. And these blooms can produce toxins, neurotoxins, hepatotoxins that are really dangerous if people drink that water.
Right, I've heard about those.
And then on the flip side, think about too much water. We see a really clear link between heavy rainfall, flooding, and surges in waterborne diarrheal diseases like cholera. It's a terrible statistic, but diarrheal diseases, they're the second biggest killer of children under 5 globally, responsible for maybe 1.4 to 1.9 million deaths a year, mostly in low and middle income countries. It just shows how vital clean water is.
A really stark reminder. Okay, and the third mechanism, climate-driven migration. People and animals moving because of climate impacts. How does that movement make the disease problem worse?
Yeah, this is a big one. Climate events, like really severe droughts or major floods, they force people and their livestock to move, sometimes on a massive scale. When people are displaced, they often end up in crowded temporary camps or shelters. Sanitation can be poor, and they might come into closer contact with wildlife than usual. All of those are, well, perfect conditions for diseases to spread.
Yeah, I can immediately see how overcrowding boosts the risk of things like cholera or malaria if mosquitoes are present. And that closer contact with wildlife, that must increase the chance of spillover, right? Diseases jumping from animals to humans, zoonotic diseases.
Exactly. Zoonotic diseases are naturally transmitted between animals, and people think Ebola, avian flu, maybe even the origins of COVID-19. When people are forced into new areas, they might lack immunity to local diseases. Or the other way around, they might carry diseases with them into regions where those diseases weren't common before, spreading them further. And the UN Environment Program makes a really critical point here, too. Often, the best defense against these zoonotic spillovers is actually protecting natural habitats. Healthy ecosystems help keep these things in check.
That makes total sense. Okay, let's shift gears slightly and spotlight some specific diseases. We hear about great progress against neglected tropical diseases and TDs, but it sounds like climate change is really putting that progress at risk.
It absolutely is. A prime example is dengue fever. The mosquitoes that carry dengue, they thrive in hot, wet conditions, exactly what we're seeing more of in many places.
Right.
Dengue incidence has already shot up something like 30-fold since the 1970s, and the projections are worrying. Scientists think dengue could become a much bigger threat in places like the southern US, southern Europe, new parts of Africa. By 2080, maybe an extra billion people could be exposed to dengue and chikungunya as these mosquitoes expand their range. It's a truly global concern now. The UK's health agency even called it one of their biggest public health risks from climate change.
A billion more people. Wow. And what about sleeping sickness? Another one maybe people think is confined to certain parts of Africa.
Sleeping sickness, which is spread by tsetse flies, is also affected. As it gets warmer, these flies can survive at higher altitudes, moving into areas that used to be too cool. Some models predict that by 2090, maybe an extra 46 to 77 million people could be living in areas at risk.
And malaria, obviously a huge global killer. What are the climate models suggesting there?
The malaria models are quite sobering, too. They suggest, conservatively, maybe a 5 to 15% increase in malaria risk globally by 2100 just due to climate change. But in Africa, which already carries the heaviest burden, they project a 16 to 28% increase in person-month exposures by 2100. We could see significant impacts in places like the African highlands again, where malaria was less common historically.
Okay, so those are vector-borne. What about waterborne threats? You mentioned cholera earlier. We're actually in the middle of the 7th global cholera pandemic right now, aren't we?
Yes, we are, and Malawi had a devastating example recently. Their deadliest cholera outbreak ever happened in 2022-2023, right after two severe tropical storms caused widespread flooding.
Oh, wow.
But it's not just cholera. Other bacteria in the Vibrio family, which includes the one causing cholera, they seem to be spreading too. The length of coastline suitable for these bacteria has grown significantly in recent years, up 35% in the Baltics, 25% in the Atlantic Northeast U.S., 4% in the Pacific Northwest, just between 2011 and 2021. Yeah. And even things like hepatitis E outbreaks, they're often linked to water stress, like during droughts when water sources become concentrated and potentially contaminated.
And ticks. We definitely hear more about tick-borne diseases spreading.
We do. Diseases like Lyme disease and tick-borne encephalitis are expected to increase across the Northern Hemisphere. Just a 2 degrees Celsius warming in the U.S., for example, could boost Lyme disease cases by over 20%. The season might start earlier, last longer. The deer tick, the main carrier in North America, is already moving further north into Canada and the upper Midwest U.S.
It feels relentless. And it's not just bacteria and viruses. You mentioned fungi earlier. Are we really seeing fungal infections emerging because of climate change?
It's an emerging concern, yes. The worry is that as the planet warms, some fungi might adapt to survive at higher temperatures, temperatures closer to or even exceeding human body temperature. Our body heat is usually a pretty good defense against most fungi. But if fungi adapt, that defense might weaken. We've seen examples like Candida auris, a drug-resistant fungus that seemed to emerge almost simultaneously on 3 different continents. And Cryptococcus gattia, usually found in warmer places, has turned up in Canada. It suggests microbes adapting to warmth is a serious potential threat.
This all sounds like it feeds into that unsettling idea of disease X, the unknown future pathogen. How does climate change increase the risk of these zoonotic diseases, these potential new threats?
Well, recent research tried to map this risk. It found that about 9% of the world's land area, home to about 130 million people, is currently at high or very high risk of outbreaks from known WHO priority zoonotic diseases. That includes things like Zika, Ebola, SARS, Nipah, Rift Valley fever, and also leaves room for that potential disease X.
And what drives that risk?
Factors like higher temperatures, changes in rainfall, even moderate water scarcity can play a role. Scarcity can force animals to congregate around remaining water sources, making it easier for pathogens to jump between species and potentially to humans.
Is there anywhere particularly high risk?
The study highlighted Papua New Guinea as having perhaps the greatest overall risk because it faces a high level of threat combined with limited capacity to respond quickly to an outbreak. And while we can't directly link the spread of COVID-19 to climate change, some studies do suggest that climate-driven changes in bat habitats might have increased the chances of human-animal contact, potentially playing a role in its emergence. It's complex.
It really is a complex web. It's clear humans are affected, but what about the wider environment? Wildlife, livestock. How does climate change hit them, and how does that loop back to us?
Yeah, wildlife health is profoundly affected. We're seeing parasites shift their ranges, like lung parasites in caribou are moving further north. Avian malaria is hitting birds at higher elevations in Hawaii where they never encountered it before. Wild animals, especially birds, often act as sort of canaries in the coal mine, early indicators of climate impacts because there aren't many control measures protecting them. We see the changes in their health patterns quite clearly.
And livestock. That's obviously tied directly to our food and economies.
Absolutely. For livestock, things like Rift Valley fever and blue tongue, both spread by insects, are becoming more intense or frequent in some areas. This directly impacts our food supply and farmer livelihoods. Warmer temperatures can also weaken animal immune systems, and some parasites, like certain worms, are spreading further north in Europe. Rift Valley fever outbreaks, for instance, tend to be worse during droughts or El Nino events. Blue tongue outbreaks could become 5 to 7 times more frequent by mid-century in some scenarios. Because we have such good long-term records for livestock diseases, it's actually sometimes easier to directly link the changes to climate than it is for human diseases.
Okay, it's a lot. It sounds incredibly challenging, maybe even a bit overwhelming to think about. But you said earlier this isn't about climate doomism. So, connecting all this back to the bigger picture, what are the solutions? What kind of collaborations do we need to tackle these threats?
This is really where the One Health concept becomes so crucial. It's the recognition that human health, animal health, and environmental health are all deeply interconnected. You can't effectively tackle these problems in isolation. So One Health is a collaborative strategy. It means breaking down the traditional silos between, say, human medicine, veterinary medicine, environmental science, social sciences. It's based on understanding that human well-being is fundamentally tied to the health of all species and ecosystems. We're not separate, we're interwoven. Our solutions have to reflect that reality.
It makes so much sense when you put it like that. We can't just focus on human doctors. We need the vets, the ecologists, everyone talking to each other. So what does that look like in practice? What are the benefits?
The benefits are really tangible. It leads to much stronger early warning systems. If you're monitoring disease in both animal and human populations together, you can spot potential threats much earlier. It improves risk assessment because you're looking at the whole picture. It allows for better preparedness, like developing joint response plans before an outbreak happens. And it helps target interventions more effectively. Maybe that's improving biosecurity on farms, or working to reduce deforestation, or regulating the wildlife trade, things that address the root causes across those different sectors.
Are there examples where this One Health approach has really worked?
Oh, definitely. Detecting avian influenza, bird flu, early in poultry populations has been critical in preventing large-scale human outbreaks in many places. That requires vets and public health officials working hand in glove. Collaborative efforts have also been key in controlling diseases like rabies, which involves managing wildlife populations, vaccinating domestic animals, and treating human exposures. And controlling Nipah virus outbreaks often requires understanding bat ecology, pig farming practices, and human behavior. These successes really show the power of integration.
Okay, so on the policy level, what's the takeaway? It sounds like we need a two-pronged approach. Cut greenhouse gas emissions and deal with the health impacts already happening.
Exactly that. We urgently need more investment in public health systems, especially in developing countries. They face the biggest burden, but often have the fewest resources to adapt. That includes boosting things like genomic surveillance, being able to quickly sequence viruses or bacteria to track how diseases are spreading and changing. And it means building climate-resilient healthcare facilities, disaster preparedness plans. Things like the Sponge Cities initiative in China, designed to absorb heavy rainfall better. That's a climate adaptation measure with direct public health benefits, reducing waterborne disease risk.
As we kind of bring this deep dive to a close, it does raise that big question. How do we face these huge challenges without just feeling totally powerless or, falling into that climate doomism?
That's such an important point, and I think rather than despair, we can actually draw real lessons and even hope from the COVID-19 pandemic. It showed what humanity can do when faced with a global crisis. Think about the incredible speed of scientific progress. New tools like wastewater testing to track outbreaks, rapid genomic sequencing becoming widespread, and significant capacity in terms of labs, equipment, skilled people was built up quickly, even in lower resource settings in the global south. We do have the tools, we have the knowledge, we have the potential to act decisively. It's really a call to action, not a reason to give up.
That's a really powerful way to frame it. What a deep dive this has been. We've seen so clearly how climate change isn't just over there, an environmental issue. It's right here, a profound public health crisis. It's woven into the spread, the emergence of infectious diseases, shifting mosquito ranges, contaminated water, people forced to move. The ripples reach everywhere, affecting all of us.
And understanding these connections, these intricate links, that really is the first step. It's the foundation for protecting ourselves, protecting future generations. The challenges are absolutely immense, yes, but so is the potential for working together across disciplines, especially using that powerful One Health lens.
So maybe a final thought for everyone listening as you go about your day. If the health of, say, caribou way up in the Arctic or mosquitoes in the African highlands can directly influence your health, your food security, thousands of miles away. What does that tell us about our shared responsibility? What does it demand of us individually and collectively on this interconnected planet?